am not licking my lips all the time as I used to. I'm rarely licking my front teeth. My mouth doesn't feel as dry. One of the worst symptoms I had with TD was these chewing motions where I was chewing, but there was no gum or food inside of my mouth. And that's gotten much better thanks to my TD medication. I have a lot more confidence. I'm not afraid to go out to dinner with a friend.
From starting treatment with my TD, I've noticed less movement of my mouth and my jaws, less movement of my tongue, less movement in my hands, my feet, my legs, just a sense of calmness to my body.
My symptoms have become a lot less evident. The hand movements are better. The scratching, the slapping, I don't notice it as much anymore. My legs, I can sit with them crossed or uncrossed, and I tend not to be crossing and uncrossing as I was before.
At one point where I was afraid of being around people because I would be judged for these movements that were in my mouth. The movements were no longer noticeable, it seemed, and I felt more confident.
Now that my TD symptoms have gotten better, I am able to experience more life, meaning events, not being secluded as much, and able to attend my son's school functions.
Since starting treatment for my TD, my symptoms have reduced. I don't notice them as much, and my family has commented that they don't notice it as much either. I feel more confident, and it's made a difference in how I perceive myself and how I interact with people. My message to those who have TD and have not started treatment or are contemplating treatment would be to encourage you, because it has made a difference to me.
Important information. Approved uses. INGREZZA valbenazine capsules or INGREZZA sprinkle valbenazine capsules are prescription medicines used to treat adults with movements in the face, tongue, or other body parts that cannot be controlled, tardive dyskinesia, involuntary movements, chorea of Huntington's disease. INGREZZA or INGREZZA sprinkle do not cure the cause of involuntary movements and do not treat other symptoms of Huntington's disease, such as problems with thinking or emotions. It is not known if INGREZZA or INGREZZA sprinkle is safe and effective in children. Important safety information. INGREZZA or INGREZZA sprinkle can cause serious side effects in people with Huntington's disease, including depression, suicidal thoughts, or suicidal actions. Tell your healthcare provider before you start taking INGREZZA or INGREZZA sprinkle if you have Huntington's disease and are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings. This is especially important when INGREZZA or INGREZZA sprinkle is started and when the dose is changed. Call your healthcare provider right away if you become depressed, have unusual changes in mood or behavior, or have thoughts of hurting yourself. Do not take INGREZZA or INGREZZA sprinkle if you are allergic to valbenazine or any of the ingredients in INGREZZA or INGREZZA sprinkle. INGREZZA or INGREZZA sprinkle can cause serious side effects, including allergic reactions. Allergic reactions, including an allergic reaction that causes sudden swelling called angioedema, can happen after taking the first dose or after many doses of INGREZZA or INGREZZA sprinkle. Signs and symptoms of allergic reactions and angioedema include trouble breathing or shortness of breath, swelling of your face, lips, eyelids, tongue, or throat, or other areas of your skin, trouble with swallowing, or rash, including raised, itchy red areas on your skin, hives. Swelling in the throat can be life-threatening and can lead to death. Stop taking INGREZZA or INGREZZA sprinkle and go to the nearest emergency room right away if you develop these signs and symptoms of allergic reactions and angioedema. Sleepiness and tiredness that could cause slow reaction times, somnolence and sedation. Do not drive a car or operate dangerous machinery until you know how INGREZZA or INGREZZA Sprinkle affects you. Drinking alcohol and taking other medicines may also cause sleepiness during treatment with INGREZZA or INGREZZA Sprinkle. Heart rhythm problems, QT prolongation. INGREZZA or INGREZZA Sprinkle may cause a heart rhythm problem known as QT prolongation. You have a higher chance of getting QT prolongation if you also take certain other medicines during treatment with INGREZZA or INGREZZA Sprinkle. Tell your healthcare provider right away if you develop any signs or symptoms of QT prolongation, including fast, slow, or irregular heartbeat, heart palpitations, shortness of breath, dizziness or lightheadedness, or fainting or feeling like you are going to faint. Neuroleptic malignant syndrome, NMS. NMS is a serious condition that can lead to death. Call a healthcare provider right away or go to the nearest emergency room if you develop these symptoms and they do not have another obvious cause. High fever, stiff muscles, problems thinking, irregular pulse or blood pressure, increased sweating, or very fast or uneven heartbeat. Parkinson-like symptoms. Symptoms include body stiffness, drooling, trouble moving or walking, trouble keeping your balance, shaking, tremors, or falls. Before taking INGREZZA or INGREZZA Sprinkle, tell your healthcare provider about all of your medical conditions, including if you have liver or heart problems, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Make sure you tell all of your healthcare providers that you are taking INGREZZA or INGREZZA Sprinkle. Taking INGREZZA or INGREZZA Sprinkle with certain other medicines may cause serious side effects. Especially tell your healthcare provider if you take digoxin or take or have taken a monoamine oxidase inhibitor, MAOI medicine. You should not take INGREZZA or INGREZZA Sprinkle if you are taking or have stopped taking a MAOI within the last 14 days. The most common side effects of INGREZZA or INGREZZA Sprinkle in people with tardive dyskinesia are sleepiness and tiredness. The most common side effects of INGREZZA or INGREZZA Sprinkle in people with chorea associated with Huntington's disease include sleepiness and tiredness, raised itchy red areas on your skin, hives, rash, and trouble getting to sleep or staying asleep. These are not all of the possible side effects of INGREZZA or INGREZZA Sprinkle. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA Sprinkle are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZATD.com and medication guide at INGREZZAMGTD.com.